to brief you about the latest of the COVID. Joining this briefing include Ms. Wu Qianyu, Level 1 Counsel of the Municipal Health Commission, and Mr. Liu Ping, Director of the Municipal Economic and Social Development Commission. First, let me give the floor to Madam Wu. Good morning. On April the 2nd, we have added 438 new confirmed cases and 7,788 asymptomatic cases. Among the 438 confirmed cases, 16 are found or identified in the closed-up area, and more than 300 of them have been identified through the massive testing. 73 of them have been converted from asymptomatic cases. Among the 7,788 asymptomatic cases, 630 of them were identified in the closed-up areas, and the remaining were identified through massive testing. We have 277 female confirmed ones, and the remaining are confirmed ones that are female. We have 44 from Xuhui District, 57 from Minhang District, 107 from Pudong District, 38 from Putuo, 35 from Baoshan, 31 from Huangkou, 27 from Huangpu, 27 from Jiading, 25 from Jing'an, 8 from Fengxian, 7 from Changning, 3 from Qingpu, and 3 from Chongming District. The 438 confirmed cases, they have gone through testing and diagnosis at hospitals, and all the 438 cases I just mentioned, they have been medically confirmed and diagnosed as COVID-19 cases. As for the whereabouts of those asymptomatic cases, I advise you to follow our public WeChat account at Shanghai Information Release, and all those 7,788 asymptomatic cases have gone through diagnosis and testing. And the asymptomatic cases, as of 9 o'clock today, we have accumulated a total of 56,896 people with close contact with the confirmed cases, and they are currently in quarantine, and more than 50,000 of them have shown a negative test result. And we also identified a total of more than 87,000 people with secondary close contact, and more than 80,000 of them have shown a negative result for COVID-19 nucleic acid testing. We're currently advancing our efforts. The purpose is to cut the spread of the disease and contain the infection of the virus so as to achieve a dynamic zero COVID scenario in the whole city. And we decided that today we're going to conduct an antigen test citywide. And tomorrow, which is April the 4th, we are going to conduct another round of nucleic acid testing. We advise all the residents in Shanghai to log on to their NAT macro app on WeChat, take a screenshot, and save the QR code, and make sure that you register your personal information in a correct manner, and this is crucial to both the antigen test and nucleic acid test. Thank you. Thank you very much, Ms. Wu Qianyu. Now the floor is open for questions, and before asking the question, please also identify yourself. First question, please. Thank you. I'm with Shanghai Television. The first batch of closed-off area and the second batch of closed-off area. Have we got the nucleic acid testing results of those two areas? Mr. Liu Ping will answer your question. Thank you very much. From March 28th, the NAT was initiated covering the whole city, and we take the line of Huangpu River, and the Puxi is the first batch of the area from March 28th to March 31st. The first round of NAT was conducted, and we covered more than 13 million people. And the Puxi region is the second batch of the closed-off area. Starting from April the 1st, we conducted another round of NAT covering more than 14 million people. Both at the municipal level and at the district level, we established special task forces for NAT to coordinate relevant efforts. In the preparatory stage, our task force covered testing, sampling, reporting, and analysis at the different sub-districts and residential communities. We dispatched relevant sampling staff focusing on residential communities. Each and every 2,000 to 3,000 people are deployed with a sampling site. We arrange our staff to take the samples of nucleic acid from the population, and the population is encouraged to take the test in different time slots so that they can avoid cross-infection. The second very important link is the transfer of those samples. We request that within 1 hour, the sample has to be delivered to a testing organization. And when the testing organization is in operation, then within every half an hour, there will be a batch of samples transferred to the organization. We also mobilized different types of vehicles for the transfer. The third link is testing. Speedy test is of great importance to the efficiency of our COVID-19 efforts, and we have stepped up dynamic coordination and operation. We have accelerated the process of different links based on the capability of different sampling sites. In the meantime, based on the work pace of the testing organizations, we put in place dynamic transfer and delivery so as to balance the capabilities of different testing capabilities. And the last round of our effort is reporting. Our requirement is that whenever there is a positive case, the case has to be submitted to the local health committee or the municipal health commission. When a positive case is confirmed, there will be a designated task force to follow up with the case. Under the support of the district level and municipal level coordination, we have generally we have in general made very important headways. Next question, please.
谢谢啊，总台中国国际电视台。那么这两天呢，
I'm
有不
with
少市民进行这个抗原实际检测，请介绍一下开展抗
Over
原
the
检
past
测的
2
情况，
days,
还有对市民在
there
做
are
抗原检
residents
测过程中呢，
conducting
哪些注意
antigen
事项需要
tests.
提醒。
Can you tell us more about it and what are the precautions that we have to take when taking antigen test? Thank you very much. Well, let me take this question. I think this is a question of great concern among the residents. Antigen test is one very important supplement to the NAT. Through antigen test, we can very quickly identify positive cases, put in place quarantine measures, and conduct another round of NAT maybe. It will enable us to identify a confirmed case on an early date. In the Puxi region, we have covered more than 10 million people with our antigen test. We have identified some anomalies, and we put in place immediate control measures, and so far those measures have been proven very effective. As I have mentioned, it's a lot more speedy and it's very easy to conduct, and our residents can conduct antigen tests at their homes. Because today we are going to conduct a citywide antigen test, I advise all the residents to follow carefully the personal instructions. When you found out that your result is a positive one, you have to first and foremost report to the local community and also stay indoors, and that's very important. We are going to dispatch our sampling staff to conduct a nucleic acid test. Last time in our briefing, we said it that after conducting the antigen test, you have to properly put all those utensils and tools of the antigen test in a sealed plastic bag, and this is very important. If the test result is negative, you have to properly dispose those tools in a dry garbage bag. And that's very important. When there is a positive result, you have to make sure that all those tools are properly kept in a sealed plastic bag, and later they will be considered as the important infection sources, and they will be further disposed in a proper manner. Next question, please. Thank you very much. I'm with Guangming Daily. As we see more and more confirmed cases and asymptomatic cases, are we having any difficulties in accommodating those cases in our makeshift hospitals or quarantine centers? Well, let me address your question, and this is a very important one. Since this round of infection, we have mobilized our backup hospitals, and we are currently leveraging some makeshift hospitals, and we have some backup designated hospitals and also 11 makeshift hospitals. In the meantime, we have renovated some large facilities so as to make sure that all those relevant cases are tested and hospitalized. At the designated and makeshift hospitals, on the basis of 10 existing medical institutions, we have added Longhua, Yueyang, Shuguang, and Huangpu Central Hospitals. At present, the medical staff in Shanghai are well engaged in this mission, covering COVID-19 prevention, testing of nucleic acid test, hospitalization, quarantine, and treatment. In order to ramp up our efforts, there is a medical team dispatched from the national level, and we also have medical assistance teams from bordering provinces and cities, and they have already been deployed at those makeshift hospitals. And you see those hospitals from Jiangsu, Zhejiang, and Anhui provinces, sampling staff from those three provinces. They were the first to arrive in Shanghai to relieve our pain and difficulties. And here I would like to pay a special tribute to all those provinces. All right, thank you very much. This is the end of Q&A session. If you have other questions, you can get in contact with the Information Office of the Shanghai Municipal Health Commission, and we will keep you posted if there is any new updates. Thank you.